Coming to compliance, the change in the lung volume per unit change in the airway pressure, that is delta V divided by delta P, is the stretchability or the compliance of the lungs and the chest wall. So where V is the volume of the lung and P is airway pressure, and the delta is the difference, and usually compliance is expressed as a liter per centimeter of water. Some of the factors influencing compliance, that is the elasticity of the lung, changes in the lumen size, surfactants and surface tension, blood supply, interdependence, chest wall size, shape, deformity, infection, and nerve damage. The compliance is studied under two headings: compliance of the lungs only and the compliance of the lungs and thoracic wall. Compliance of the lung. The extent to which the lung will expand for each unit increase in transpulmonary pressure is called as lung compliance. The normal value is 0.2 liters per centimeter of water. Compliance diagram of lung relates lung volume changes to changes in transpulmonary pressure. So there are two curves in this diagram: the inspiratory compliance curve and expiratory compliance curve. And this is the pleural pressures, change in the pleural pressure with the increase in the lung volume. Okay. So if you increase the pleural pressure, and that is going to increase the lung volume, and if you decrease the pressure, the lung volume is going to decrease with the respiration. The compliance is slightly greater when measured during the expiration than in inspiration. The compliance is determined by mainly the elastic forces of the lung tissue itself, which contributes about 1/3 of the compliance, and the elastic force caused by the surface tension of the fluid that lines the inside wall of the alveoli and other lung air spaces, which contributes about the 2/3 of the compliance. The elastic force of the lung is determined mainly by the elastin and collagen in the lung parenchyma. Compliance of lung and thoracic wall. It is the compliance of entire pulmonary system. It is measured while expanding the lungs of a totally relaxed or paralyzed person. To inflate this total pulmonary system, almost twice as much pressure is needed as to inflate the same lungs after the removal from chest cage. The normal value is 0.11 liter per centimeter of water. It signifies that when there is an increase in airway pressure by 1 centimeter of water, then the volume of the lungs inside the thoracic wall increases by 0.13 liter. Note that the curve is shifted downwards and to the right, that is compliance is reduced by pulmonary congestion and interstitial lung fibrosis or pulmonary fibrosis, where there will be stiffening and scarring of the lung tissue. The curve is shifted upwards and to the left in emphysema, where we say the compliance is increased. So this is the diagram showing the relation between transpulmonary pressure and increase in the lung volume. So this is the normal curve, whereas it is shifted to the right side in fibrosis, where there is no much expansion of the lung occurs with increase in the transpulmonary pressure. And the curve is going to shift to the left side in emphysema. Specific compliance. Compliance with reference to the lung volume at which it is measured, that is the FRC, is called as specific compliance. So specific compliance is equal to compliance divided by FRC, that is functional residual capacity. Specific compliance is used to compare the compliances of lung of different sizes. In individuals with having only one lung, the lung compliance is approximately half of the normal compliance. Similarly, in children, because of the smaller lung volume, compliance will be below normal in spite of the normal distensibility. This confusion is removed with a specific compliance since FRC is proportionately reduced and specific compliance remains